There we go.
Okay. Are we live?
Yeah, I think it's good.
Hello, you guys. Welcome to today's first aid presentation. I'm Dr. Andrew Jones. Welcome. Thanks for being here. Before we get going, you just want to make sure you guys are you're able to get on and you can see and hear me. So if I assume there's a comment box, so I'm here with my interviewer, Eliza, who also happens to be my daughter. She also works for our company, Veterinary Secrets. And because she's my daughter, I can also tell her what to do. Actually, not really. Anyway, she's the smarter tech one of the two. So we're able to figure this out and actually have a live stream today. Hooray. Yay. So first thing, I just want to make sure that you're able to see and hear me. So Eliza, is that working?
Yep, it's looking like everybody can hear you. Good.
And
clear.
they can see me. Hey, well,
Yep.
I mean, you don't need to look super hard. So first, welcome. Thanks for being here. We're going to cover a bunch of things today, and I just want to make sure I'm not going to forget anything and start out. So I've made myself kind of a bit of a list here that I want to fully cover. And what I want to do in general, just talk about emergencies in our dog and cats. Most of us think, we're close to a vet, we can just go ahead and rush your dog or cat into a vet, and in many times that's what you're doing. But there's going to be certain situations where either one, you're a little ways from a veterinarian, there's been a pretty serious emergency with your dog or cat, they've suddenly collapsed, for instance. Maybe they've eaten something and it happens to be 12 or 1 o'clock in the morning. Your emergency veterinarian's an hour away. Regardless, there's certain things that you really should know because it can make such a big difference. And I saw this many times in veterinary practice where certain clients, they were a little bit more comfortable with first aid. It made a really big difference, right? I mean, I can think back to an animal that was hit by a car. He actually had broken his femur, his rear leg, but it also lacerated one of the big arteries, the femoral artery. So they were able, just to calm themselves, like, what do I need to do? And they were able to properly pack that wound, apply a whole bunch of pressure, do somewhat of a tourniquet on it, and slow enough bleeding down so we could get into the clinic. Whereas majority of us, and originally myself included, just being this unknown pet parent, you're just thinking, get to the vet as soon as I can, which is what you need to do for sure. But in the interim, if they hadn't done that, pretty sure that dog would have died. So there's lots of big reasons why, and I hope I'm going to show you a bunch of those things today that you can apply to your dog or cat. And things I think can really help you out. Liza, have you ever had the need for first aid?
Probably.
Okay, probably. Not with the pet?
No, not in my experience so far.
Although you did have a guinea pig that had some pretty serious health issues where he started to seizure.
Yes, that was not so good.
Yeah, but unfortunately, especially with guinea, we're going to talk about seizuring. There's not a lot you can do, but you can definitely make sure your dog or cat's not injured, or your guinea pig, and you can kind of support them while they seizure. So let's just get into our presentation. Now, the first one I want to cover is just being prepared for emergencies. As far as, what are the big things you should know and do and where to start out? Well, number one, no emergencies happen. Number two, have it in your phone. Of course, my phone's not here, but I'm just going to grab my phone for sake of presentation here. Just add in your veterinarian's emergency contact. If it's another emerge clinic, get that into your phone. Third thing, and I think I might cover in our pet first aid kit, is going to be having a pet first aid kit. We're going to go over all the things that I think are important to have in a pet first aid kit, right? And then the fourth part of that is having also a poison control number on there, whether in the US, whether you're in Canada, for instance, or whichever country you live in. Most places have some form of animal poison control. You can hit a number and contact to and quickly say, this is what I think my dog or cat is consumed. What should I do? So those are some just big things of being prepared, right? Just that whole common sense stuff. And I think the third thing I want to mention is just about practicing, is that you're going to learn these skills today, but I really encourage you to go ahead and take a pet first aid course. and practice some of those skills, because it's one thing to know it. Like, okay, I've read about it. I've experienced it, the same thing, starting out in practice. Well, I know what to do till something happens. And then you're like, oh, now what do I do? Because you don't have time to flip through the textbook. But if you practiced it, it becomes a lot easier, and you're much more likely to then go ahead and do the correct thing. Next part, what should be in your pet first aid kit? I believe that's what I wanted to cover.
And yeah, before you keep going with that, I just want to say for everyone who's watching, so he's going to go through these questions, and then at the end, just about 10 minutes or so, we'll do a Q&A. So if you guys have questions as he's going along, make sure you put them in the chat. I'll be trying to keep track of them. And then at the end, we'll try and go through those. But anyways, Continue on with your questions.
Okay, so let's get into what should be in your pet first aid kit. Information, or either you've got your phone number for your veterinary clinic in your phone, or you've got a little info. You've written it down, including the emergency contact. Poison control, I think it's a great idea to have one of those numbers either written down in your phone as well. I also just gotta make sure my phone shut off so it doesn't start ringing. Number 3, just a baseline of your pet's temperature, pulse, respiration, weight. Like for instance, Tula's temperature normal is about 38 degrees Celsius. That's about 101.5 degrees Fahrenheit. Her pulse is about 80 to 90 beats a minute. She's a pretty darn fit little dog. Respirations, about 16 breaths per minute. Her weight, she's about 22 pounds. But have a baseline so you know, just it, because what happens, and you can assess it in emergency, and all of a sudden, oh, okay, your dog shouldn't have a pulse rate of 160. That means something. We're going to cover that. So let's get into some of the things that are on my table here. Good idea to just have a basic digital rectal thermometer. Know how to use it. Take your dog's temperature. Take your cat's temperature. Inexpensive thing to have. I want you guys to all have exam gloves. Have a couple of these in your first aid kit, right? There's a bunch of different reasons why you're going to need this, whether you're cleaning a wound, etc., etc. Have a few of those gloves. See, I'm trying to do it in a bit of an order here. We've got exam gloves. In terms of helping either one lubricate that thermometer, deal with the wound. Vaseline is actually a super inexpensive thing to have. And what we're finding now for wound care, especially, one of the big principles of speeding healing is once you've flushed and cleaned the wound, is that you're keeping it covered and protected from air. A simple and inexpensive thing is Vaseline. Something else, which I think is probably a little bit better as far as because it's got medicinal properties to it, some type of beeswax mix. So this is one with beeswax, a bit of coconut oil as a combination. And it also would make a really good topical, I don't know if you guys can see much, wound care. But just have that, one of those in stock, like as either part of your first aid kit. See, what else am I getting on here? Now we're going to talk about some of the bandage material. Right, some of the things I think should have. Tape. This is adhesive tape. This one is actually hockey tape. Regardless, you want to have some adhesive tape. You want to have some cotton, either cotton balls. We're going to use this most of the time for wound care, but wiping things. But specifically, one of the bigger things, your cat may be bit, maybe have an abscess. You're going to use these. Your dog may have a laceration. You're going to be cleaning with something like this. So the cotton. Blunt tipped scissors. It's a really good idea to be able to remove all that fur. Your dog, for instance, has this wound. You want to trim the fur all around the edge of the wound. Scissors like this that have this blunt tip are just a good idea to have on hand. This isn't fully blunt tip. There's a small point on this end. And because I can also use these as bandage scissors. They double up as both. But have these, because you're not going to have clippers. You can't just clip in the field, for instance. So another thing, we want to 4x something like these. These are 2x2 gauzes. You can, or sponge pads. You can also get the larger ones, the 4x4. And most of these things I just picked up at the local pharmacy, and they're all pretty inexpensive. And I don't want you guys to have to spend a whole lot, but I do want you to have some basic stuff in hand. A good antiseptic cleaner, some of these inexpensive alcohol swabs. These are disposable ones, like these. And you can get them at any pharmacy. You guys have those. Some of the other stuff on here, I'll just go through it as I have it. This would be cling. So after you, we'll start up with cling here. When you're trying to wrap up leg, for instance, say we're trying to manage a wound after potentially bandaging it, you're going to put some form of cling on over after that. We're going to talk about wound care after that. But I want you to have a wrap of this cling gauze. Use this a ton in practice. After that, I don't know if it may not be in exact order. For many of the wounds, for instance, one of the big things too is putting on one layer. This is a non-stick Telfa pad. So I'm going to rip it open so you guys can see. So often, once you've cleaned that wound, you want to put, when you're first covering it, you want to make sure that it's not going to stick, because you don't want to debride all that tissue. It's super painful. In some cases, just doing it initially for first aid before you get in to see your veterinarian. But having a non-stick pad is really essential, right? So you put that over top of the wound, and then you put your bandage material after that. And there's a bunch of different ones. This is the non-stick Telfa pad. Great idea to have on hand. And this is the vet wrap. So this is the stretchy bandage material. I love this stuff. Use this so much in practice. Also use it on myself. Use it in my human first aid kit. I did see you can actually go to one of the farm stores. Is there any of the farm supply stores? And this stuff is so much less expensive, right? Because if they got to sell the horses are big critters. They take a lot of this stuff. It's a fraction of the price. So instead of staying $5 for this thing, you could spend like $1.50 or $2. But get yourself some vet wrap. This is all really good basis of bandaging material. Let's see what on there have I missed. Okay, for an antiseptic cleanser. This one is chlorhexidine, right? And of all the different antiseptic flushes out there, I think this is probably the best one. This one here is a 2%, so it's already pre-diluted. So you just put some of that onto the gauze. Then you're going to be scrubbing the wound, right? Great antiseptic. And then you're going to be putting on that non-stick Telfa pad, then likely this cling, and then you're probably likely your vet wrap. But yeah, get yourself, and this is a smaller bottle. Obviously, if you're in an emergency and you're out and obviously you don't have all this stuff, something as simple as just water and even soap is fine. Because one of the big principles when there is a wound is you need to clean it really well. So you need the benefit of soap as well. Obviously you don't have sterile water or whatever. This is all completely fine. So it's soap and water is fine, and then you flush it after the fact. Some of the other things I have in here, syringes, which are awesome, right? Big, this is a 60 cc, a 30 cc, maybe a 10 cc syringe. These are great for wound flushing, right? Just get yourself a bunch of syringes, super inexpensive, and just think of all the different things. You get medication via these. You can have, clean ones. You can flush eyes. You can use it for ears and eardrops. A whole array of different uses. Syringes, wonderful. Okay, what else do I have in my mix here? We're getting near the end. Forceps or tweezers. These were actually forceps that I would have used in surgery, but they double up as wonderful little tweezers. It's great to be able to grab tissue, move it around, pull things out, for instance. There's a little bit of a stick or there's rocks within that wound or whatever. A little pair of forceps. We have to cover the scissors. And let's see here. A few other things. A tourniquet. So this is something I haven't mentioned, and I seldom ever see this in any of the pet first aid kits. But one of the big principles of bleeding, for instance, obviously stop the bleeding. But if there is a major artery lacerated, like the femoral artery, for instance, right? So that's the inside, that's the leg incident, or else maybe it's something up high. Could even just be some part of the like a radial artery, right? In the front part of your dog's leg. They just produce so much blood. And the principle of packing is important. Where you cover the area that's bleeding, you put stuff on top of that, you put pressure. But if there's an artery lacerated, you're not necessarily going to be able to slow the bleeding. So this is a tourniquet that we used to use in veterinary practice, really inexpensive. And it's got this little clip on it to make things so you even tighten it like that. We're simple and easy to do. I used to use it for taking blood samples. You put a tourniquet over a dog's shoulder or cat's shoulder, the vein would pop up in the front of the leg, and that's why I take a blood sample. So this is great. Having a tourniquet, I think, is just a good idea, and something simple like this. The other benefit of the other second thing this can be used for is a muzzle, because many times our animal, I've got Tula and our new cat Cassie in here, but I'm not going to put them on the table until they need to be. I shall try with little Tula, see what she thinks. I'm just going to show you guys how to do the muzzle. Okay, Tula, Tula, say hello to the live stream. Say hello to Eliza. I'm just going to show you how easy. So you're just slipping over your dog's nose or his muzzle. You tighten it like that. Obviously, we don't need to do that with Tula. But if she was injured, and many dogs, as soon as they're injured, they're just not, like they're in acute, serious pain. So your dog you think would never bite, he could really bite. So having this could double up as a muzzle. That's all you're going to get. Go, yes. Or you could just, if you don't have this, whatever fabric, right? Use something like this cling, right? Where you tie a knot under here. I don't know if you guys can see that, where you're just tying a knot around their muzzle, right? Like this, over top of their nose. Then I tie it underneath around the back of their neck, around their ears, and tie it at the back of their neck. And that's another good way to make a sort of quick muzzle. Because a lot of times you need to move a dog or a cat that's in. Pretty hard to muzzle a cat, but you need to do that for a dog that's injured, and they're going to turn and bite. So you don't want to get injured. You don't want them to hurt themselves more. So that's when you may need to use a muzzle. And a lot of times we did in practice that was needed, right? Even just to get an animal in from a car, then hit by a car, getting from the parking lot into the clinic. A few other things. I've got flush here so this is a sterile flush. Great. It's great to have some of this stuff on hand. If you don't have this, water is fine. Because what we're doing, it's an urgent emergent situation. But this flush can also double up as an eye flush, for instance. So it's a good idea. It's 0.9% sodium chloride. Inexpensive, got it from a pharmacy. I think it's just a good idea to have some of that in your first aid kit. A few other things I have. Let's see, a towel. I actually have this little emergency blanket. This I think scooped out of my daughter's first aid kit. Thanks, Eliza. I was looking at what else I could add to a first aid kit. I thought, this is a good idea. Simple little foil blanket. Who knows where you are out. Many times, like one of the big things is your animal staying warm. You could use this to have them stay warm. Well, we're just blanket. The other thing I think is a good idea, if you can have a thin little towel. And sometimes, and I think Eliza might recognize this. See that, Eliza? It's your Barbie towel.
I do.
It's not my Barbie towel. Just to clarify all that. But as far as number one, you can use this blanket, even if you need to move your dog and support them, for instance. Lay it out like that, right? So they can launch. You could use it as a little bit of a stretcher. Perhaps there has been a fracture or something. You're trying to support their leg. You could wrap this around the leg first, right? And then bandage it after the fact. So something like that, you're not always going to have it. But it's, a little thin blanket or a thin little towel, just good idea to make sure that's all part of your kit, in my opinion, and it makes sense. A few other meds. I'm being a veterinarian. There's other things I like to have. Here's the thing. It's called New Skin. It's a type of crazy glue that's used for wound repair. Works awesome, right? Especially you're in the field somewhere, like you're out wherever, you're away from the clinic, and you can put a drop on either side to help close the wound, to slow down, close it, and secondarily potentially slow or stop the bleeding, right? Great for ears, for instance. They bleed and bleed and bleed. You can do whatever you can to stop the bleeding. A bit of tissue glue works awesome, and it's not expensive. I like having that in my pet first aid kit. I think pain relief is awesome to have on hand. Probably one of the only things that's safe for our dogs, safe for our cats. CBD or cannabidiol, period. 3 milligrams per 10 pounds of body weight twice a day. This is our CBD product. Obviously, it doesn't need to be ours, but I just think it's good to have that on hand. A few other meds I would think about having. Number one, gravel. Any animal that's vomiting. We're not really sure. Maybe you're a ways. Who knows the exact circumstance. But gravel is pretty darn safe. Looking at doses of these are 50 milligram tablets. So you're giving a cat about a quarter of a tablet 2 to 3 times a day. A dog's with about a quarter of a tablet per 10 pounds of body weight twice daily. Tula, get a half tablet twice a day. Then the last one, for any type of acute allergic reaction, just a good idea to have Benadryl on hand. It's definitely more fast acting than some of the other antihistamines. Has some other issues around sedating qualities, but just good to have. Doses of 1 milligram per pound of body weight, 2 to 3 times a day. So there's kind of my first aid kit of stuff. You guys are going to get and Nick will also follow up, and I'll send you a bit of a copy of this via a resource, or maybe Eliza will do that. Thanks, Eliza. So you have it. So you don't just have to take all these notes and figure out.
I have a couple questions though.
Okay.
For the pet first aid kit. So that's quite a few different things that you've listed.
It is.
If you're going on a hike with your pet, what would you recommend people have with them? Is there like a few different things that they should definitely have if they're out in the woods?
So some of the basic bandage material that I talked about. Obviously, maybe a thermometer, some gloves, the bandage material here that we mentioned, some form of antiseptic. Honestly, get yourself some type of tourniquet. Like, this is a great idea. I hope we can find a link for this, because there's certain things that you can't. Most things can wait. Even something like Benadryl is a good idea to have it. Yeah, you do. But majority of the time, our dogs and cats, they don't have serious allergic reactions like people do, where we have all of a sudden we get stung by a bee and it's difficulty to breathe. Our animals more typically have those reactions in their skin. But I would have some Benadryl on hand. And what else? As I talked about the bandage material, a syringe or two for flushing, some of the vet wrap. Maybe you don't need the emergency blanket, but something that would allow you to cover, say there's been a laceration or a cut. Even when this little blanket, I think, would work in a pinch like that. When you're thinking about the big things, it's trying to think what's most common or most likely to happen in that situation. And obviously, you're taking your phone. I mean, we all have phones down. Most places are going to have cell phone access. So you should be able to reach somebody pretty quickly. But you need to think about what potentially could happen. They could fall, they could get injured. You maybe have to transport them out. So think that through, right? Like, okay, like Tula, for instance, I took her out biking, and all of a sudden I think she hurt one of her rear legs. So I had to figure out, how do I get her out of here from wherever I was? And, I'm on a bike, so I was able to you have to be creative in some situations. So I just stick her in my backpack, put my backpack on my front, and Tula rode in my backpack. Anyway. So know that you have to be somewhat creative if there is an injury or wound or whatever. So it's how many you can best transport your dog, if that's the case, or maybe your cat goes with you if that's the case, right, from wherever you're out and to a clinic.
Okay.
A couple things. Let's get going here, because I know I've covered. I want to cover a bunch of things, but it's always I end up having way too many things listed. I actually read this acronym, and I haven't discussed it before. It's sort of thinking of what to do in an emergency, right?
Okay, but just before you get into that, I just want to say to everyone, for the pet first aid items, I'll put a list of it in this video on YouTube, because it will be available afterwards, just under the live stream tabs. We'll put the information there, as well as potentially Dr. Jones will put that in the newsletter that he sends out every week. Could add a little list of first aid for that. So if you also don't follow for that, you should make sure you go sign up. And then I can go back to your question.
Okay. What to do in an emergency? There's this general acronym, and they said, think about it, it's called DR, Doctor ABCs. So, and when you're and it's really good to think of certain things. And I actually took a human first aid course. It's actually a wilderness first aid course a few weeks ago. And there's a bunch of human acronyms they use in first aid. So it's gives you a quick checklist. So the D stands for danger, like assess the danger to your pet, yourself, like wherever the situation is. And the R is, are they responding? Lamb chop, are you there? The lamb chop's not moving. Is lamb chop breathing? If I touch her, does she pull her little paw back? Oh, she doesn't. So you're assessing, is your dog or cat responding? Like, how are they responding or not? So danger, response. Then A stands for airway. They have a patent airway, right? Are they breathing? Do you feel air, moving through their nostril? Can you hear, right? Can you put your hand over top of their chest, feel their chest move? Breathing, right? Are they breathing or not breathing? C for circulation, right? And C is meaning, do they have a pulse, right? If you put your here, can you hear their heart beating? Put your hand right in behind their left armpit. Do you feel a heart beating, right? So that's assessing circulation. And the A, when I'm looking at airway, means is there an open or patent airway, right? It kind of goes along with breathing, but it just helps us think going through all the steps. A, B, C. And then the last thing is the ABCs is S, is like send someone else for help, right? Like something's happened. Say all of a sudden a dog just suddenly collapsed on the dog walk, right? A big dog, like our last dog, Lewis, he was probably 80 pounds. You're not going to easily carry your dog back, right? So send someone else for help. So think of that, like you quickly. And the other big thing is before you do anything, just like take a deep breath, like get yourself a little bit calm, and then start going through the steps. Like the worst thing to do is like rush in and do this. Just take a second, get yourself calm, look at your surroundings, make sure you're safe, make sure your dog or your cat's safe, and then start, doing your assessment. And we'll put that in too. I really like that, the DR ABCs. Number 4, what to do if your bed is collapsed. So all of a sudden, right? Oh, Cassian. Cassian the cat is going to be our example. Oh, you lucky kitty cat. Yeah, you guys can see him there. Let's see how well you do as a star on YouTube, Cassian the cat. So he suddenly collapsed. Like, okay, I don't know. All of a sudden he just dropped to the ground. He was walking fine. He was eating his food, and all of a sudden he just drops. So what do you do, right? A bunch of potential causes, but the first thing is just step back for a second, take a deep breath, right? Okay, now what's going on before you rush in, and then quick look around. Is there anything weird going on? Do I smell anything weird? No. Like a weird gas? No. And then go in and quickly assess your dog or your cat, right? So, and there's a bunch of potential causes. It may be low blood pressure. There may be some, right, internal disease. There's a whole bunch of different things that could trigger that, right? Maybe a low blood sugar, But more often what I'm trying to get to is more likely you're dealing with an animal that's in shock. And it's not like that you just receive shocking news. It's you've got a medical condition, right? And this is an acute onset of something has happened, like for instance, there's internal bleeding. So you've got this marked low blood pressure leading to this rapid loss of blood pressure. And that's going to cause low blood supply to the brain. Your dog potentially going to drop. They don't have enough oxygen, right? Just to stand up and look around. A bunch of different things can cause that, but you need to just assess, like if they're in shock, which means they've got low blood pressure. So one of the signs, and I don't know if you can see him, probably not in Cassian, but you lift up his lips, you look at his gums. Cassian's got nice pink gums. That's healthy. He's not a cat in shock. If he was in shock, that'd be white. One of the other things I would assess is called CRT or cap refill, where I put my finger on top of his gums and I see how quickly it'll be white for a second and then it goes back to pink. For an animal that's delayed, if it's more than a second that's delayed, sometimes in practice I would see 3 or 4 seconds, really delayed cap refill. So that's a measure of blood pressure, right? So when it could be that they're bleeding internally, that's why you see it. They call it hypovolemia. Or maybe they've been hit by a car, right? And they've got a lacerated spleen. Or sometimes you can even see that with the poisoning. So that's it. And you should all be able to do a cap refill, measure CRT, right? Then when you want to assess, like, is their heart rate elevated or not? Typically an animal in shock, their heart rate is markedly elevated. So normal Cassian's normal heart rate probably be about 140 to 160. If he was in shock, it would potentially at least be 240, 260, right? Almost double that. And believe it or not, his heart rate is still surprisingly slow. He's such a funny cat. He actually likes to have things done to him because then he gets attention. You'd also expect your dog or cat's going to be breathing much heavier and a lot faster. So you might see deep labored breaths where their chest wall just comes straight out, or they're going to be breathing quite fast. And you're going to see that. And so, for instance, I would see that with an animal that's come in. Maybe they've been poisoned. Maybe they've eaten something like antifreeze. They're going to show some of those signs of shock, and that's one of the clinical signs you see. They're just this rapid panting. An animal that's got heat stroke, much the same thing. They're rapidly breathing, just like that, and you're also going to see this really thick, marked drool come out of these dogs. So so the big point there is you assess this animal. Clearly, you've got a dog or cat likely in shock, and then you're left with like, what do I do? And I want to mention a couple things, because in general, for many of the pet first aid suggestions is you assess your dog or cat, you call the vet. Like it's all call the vet, which is yes important, and yes you need to go see the veterinarian. But I want to add a few other things that you potentially can do to maybe help your dog or cat while you're getting there. So a couple big points. Number one, make sure they're in a safe place. You've looked around, you've assessed like the area where they drop, for instance. You're doing a bit of an exam, right? So you've examined your dog or cat. Maybe you felt a distended abdomen, etc. But you've made the assessment that they're in shock. So yes, they need to see a veterinarian. What I have found is number one, want to make sure they stay warm. So something warm is important. They're in a warmish space. If they're outside, get them inside, for instance. Get them out of the cold if you can. Take your coat off and put it around your dog, for instance. All of a sudden he's acting shocky outside. And one of the things I also found, because one of the possibilities could be low blood sugar. So with some animals, I used to suggest it with some clients, just get some corn syrup, some sweet syrup, and rub some of that on your dog's gums, for instance, or your cat's gums. Because it's not going to hurt, and if they have low blood sugar, potentially it's going to help. And then you're transporting your dog or cat to the veterinarian. But think of, number one, the important thing is recognizing what's going on, and number two, doing a few potential things just to potentially make it a little bit better for your dog or cat to survive whatever is going on, right? Will the corn syrup make a difference? For an animal that's got really low blood sugar, it really could. And I've seen that more than a few times in practice. And then you're going to go in and you get to your veterinarian. The next one I wanted to cover is how going about moving an injured pet. Like, an animal, all of a sudden, who knows whether it's a fight. The biggest thing would be an animal being hit by a car. And some people don't touch them. It could be his back. Yes, it could be. But yes, your animal needs to be seen. You need to try to do it as best you can. You're not going to injure them anymore. It's very unlikely you will. So I don't have to hold Cassie anymore. So the first big thing is what we talked about first. You just take a breath, stay calm. Assess the situation, right? If you want to cure, you can go down. Right? Okay, just make sure you're not at danger, your dog's not at danger, right? It's okay. I think I'm okay to then go in and assess my dog. I'm just going to make sure I'm not missing anything here. So you're going to check your pet, right? And we want to assess, are they going to grab Tula so she can be part of this, right? Look, yes, I'm going to show you how to safely move you. We've assessed, you're just favoring your left leg. Maybe your shoulder's fractured, I don't know. But the rest of you quickly seems okay. Your gum color is still pink, no sign of internal bleeding. Okay. So then it's being able to safely move her. So what obviously need to be looked at if there is any serious bleeding, you need to control that. You're going to need to do something like, you see the inside of her back leg is bleeding, you're going to apply something like cotton or whatever you have with you. And then if they bleed through it, apply more on top again, right? One of the principles that when there is bleeding going on, you cover it, you put on pressure. If they bleed through that gauze, for instance, to put more of that stuff on top, right? And then you might wrap it with something firmly, regardless. But then as far as safely moving your dog or cat, the principle here is that you can get them on a blanket or something. If you don't have any of that, you want to be able to support their head. You want to be able to support their neck and support their rear legs, right? So I've got my arm under her neck, my left arm, my right arm under her back here, supporting her back here, and then I'm carrying her that way. You don't want them like this, where you hold them like this and her head's hanging down. So you're supporting them as best you can, then moving her into the car. And sometimes, you may need to put a muzzle of some type on your dog. He's broken his leg, he's turning and trying to bite you. Because obviously they need to get in and see the veterinarian. And And the other big point is seldom, if there is a spinal injury, is that seldom does that ever make it worse. I was initially taught that in practice, like don't move these animals. Now that's considered less serious because it's more important that they get moved to a safe spot. Secondly, be seen as soon as possible, right? So that is so much better than maybe the 1 in 1,000 animals that's going to make a difference about a spinal injury. It's, supporting them as best you can, getting them in the car, getting to the vet ASAP. Thank you, Trula. Just make sure I didn't miss anything there. And obviously it's great, get someone to call your vet to let them know you're there as soon as possible. And they see you as soon as possible, especially if you've got a big emergency like that. Oh, what else? The cat, looks like Cassian the cat wants to get, Jesus. Cassian, no. He's about to knock over my monitor. Come here, kitty cat. He's such a pest. Okay, Cassian the pest. How about wounds and wound care in general? And also bleeding. Well, the basic of wound care 101, or what you for sure need to know. Number one, you see a minor wound, that's something you could probably care for at home. A big wound, a big gash, you're going to need to see a veterinarian and have veterinary care. Fair enough. The general principle, though, with any of these wounds is first, all of a sudden your dog ran into the water, going after a stick, he comes out and he's bleeding. Well, and you see this cut. Well, first of all, just examine that a little bit closer first. If there is a whole lot of bleeding, that's when you need to deal with the bleeding first, before you do anything else. Oh, Eliza, can you hear me? Oh yeah, she's still there. I thought things are frozen. So you need to deal with that bleeding first, right? Where you're going to apply whatever you have. Hopefully you've got your little first aid kit with you. You can apply like gauze or the cotton swab first, and then if you bleed through it, you apply more of that. Let's pretend it happens to be here, the side of your head. Cassian. Oh, I hold pressure here. Apply more. Oh, looks like you finally stopped bleeding. And then I might get right. Because all I want to do, Cassie, I'm not going to clip it or anything else. First, you're just stopping the bleeding and you want to get into your veterinarian. I'm just going to put on that little vet wrap. Look at that, Cassie. So, the thing with the vet wrap is usually you can rip it with your hand. There. So we got the bleeding under control. Get in and see your veterinarian. Okay. And if it got to the point, where if they kept bleeding through that, you happen to have your little tourniquet on hand, great. Obviously, you don't tourniquet the neck, but usually you're dealing with a limb. So then you can tourniquet the limb. Okay, kitty cat. The general principle, but for wound cleaning, is number one, you got your blunt scissors, you trim the hair around the edge of the wound, right? You need to better see it. Hair just brings bacteria into the wound. Great. The next thing, you can go down if you want to, kitty cat. The next thing you're going to do, you're going to flush it with some type of antiseptic flush. So here we have, this is the more concentrated chlorhexidine that I just use here in my little office, right? Bit of water, a syringe. You're going to flush that wound. Regardless, just have a bunch of syringes on hand. The biggest thing is just flushing that wound. The cleaner you can get, the better. You can use the antiseptic to start, and then after that, just wipe it with some water. Once you've done that, you're satisfied that it's clean as it can. The next big thing is, one, protecting it. If all you have is Vaseline, that's fine. Cover it with a bit of Vaseline. Because what we know now is wounds heal much better if they're covered, protected from air. We're actually seeing better wound healing, right? And there's a much increased rate of how fast it heals. I used to say in practice, don't leave it open. And it seems to be, and that's what you'd think, it's better. But when it's exposed to air, some of that important granulation tissue on the outside, it dries up. It cracks. It just takes much longer to heal. Right? So that's when you can cover it. And then after that, go through those steps of bandaging, where you've got the non-stick Telfa pad, which I'm not sure what I had here somewhere. So you would put on that mystery non-stick Telfa pad, which here's where it went to. It used to be here. So you put the non-stick Telfa pad on, and then you might follow up with the cling right to the Actually, this kind of wrap tool is a little stuffy. That'd probably be the easiest way to do it. Right. So you put on your non-stick telfa pad, which is here, right? And then you're gonna put on some of the cling, which is what I've cleaned it, clipped it, I've cleaned it with Lexidine, flushed it after the fact. Maybe I put on my non-stick pad, wrapped it with the cling. And after it's wrapped with the cling, then I'm using my vet wrap. And then I'm gonna get in and get you looked at. Lamb chop, so you can get properly treated. But that's why you want to have all the wound care stuff we just talked about. Because of all the things you're going to do, I mean, that's probably one of the most common things, right, is wound stuff. So having like this basic wound bandage material is important. I used to say put on polysporin. They actually find polysporin, Neosporin. That stuff doesn't work. If anything, it's crappy antibacterials, and it doesn't do a really good job of protecting the wound. So honestly, or else, get yourself coconut oil, that beeswax combination is good, really good idea too, or the Vaseline. Okay, and most wounds, and if there's a puncture wound, for instance, say your cat's been in a fight, and you see an obvious puncture, as best you can, really flushing that with the syringe we talked about. And if you can see where the punctures are, like get some of that cleansing, put it right over top of the skin where the puncture is, and flush that stuff right in there. Because anytime there's a bite wound, there's just a pile of bacteria injected into the skin. So as much as that you can get out, the better. If it's an abscess that's started to open up, same thing. You want to flush it, flush and flush and flush, get the bacteria out. And the different principle with an abscess is you don't cover it up. With wounds, a cut, we're going to cover that up. With an abscess, a bite wound, no, you leave those open to drain. And that's the difference here as far as how to approach wounds. Abscesses versus wounds versus bleeding. Thanks you guys for sticking through. I just want to make sure we cover everything because I think I'm running out of time. What to do if your dog or cat eats something that's toxic, right? Something that's poisonous. Obviously, there's an array of different poisons that are out there. And I think the general sense of most people, what you hear for most pet first aid courses is, when you see what it is, like remove the poison. Obviously, if your cat has been eating a lily, move the lily out of the way because lilies are quite toxic to cats. Then you follow up, and maybe it's happened something is on your dog, he's licking his paws, for instance. Like I don't know, but he just walked in the grass, and all of a sudden there's something on there. Obviously, wash that off your dog or a cat if you can. Then the third big thing, more than anything, is, at least as far as what I'm concerned, that most people say then just get off to see your vet, is number one, like figure out what the poison is. A more common thing would be, say your dog is on Rimadyl, and you've got a yellow lab like Pippi was, who was in this office many a time. Well, if Pippi could, and these are the chewable Rimadyls, she would eat an entire bottle of chewable Rimadyl for sure. And if she did, like that's seriously toxic to her liver and her kidney. So yes, you need to go see your emergency vet. You need to get to the clinic. But say you are an hour and a half away. Who knows? Or today there's a snowstorm. It's going to take you a long time to see your veterinarian. So if your dog has consumed something that's poisonous, or your cat, right, that can cause serious clinical signs, go ahead. You're not sure, call poison control. Like I said, they've eaten too much chocolate. Get online, calculate the amount. You can calculate the amount of theobromine that's in there and caffeine, know if it's toxic or not. But regardless, for many of those times, the best thing to do is get them to vomit. Right? And it made such a difference. I had a number of clients who do that first. And once they got their dog or cat to vomit, that was it. They didn't need to have all this extended care. So to do that, you need casein, 3%. As long as if the screen goes dark, it's because the cat has chewed on the cord. Casein. We need 3% hydrogen peroxide, and the standard dose is 5 mils, which is 1 teaspoon. But it's a lot easier to measure it with this thing here. So this is a 10 cc syringe. Half this syringe is 5 mils or 5 cc's. I'll just show you how I would do it with how I would give it. So let's say, for instance, Tula was on Rimadyl. She got into the bottle of Rimadyl. I would just get her to vomit, right? Period. So I dropped the 5 cc's here. I'm not going to draw it up because you don't need to vomit, Tula, right? I'd seat it in the side of her mouth here, right? And I just squirt it in. Tilt her head back, hold her muzzle, watch her swallow. As she sticks her tongue out, she's swallowing. Or she's swallowing air, but that's fine. Hold it there. Oh, you swallowed all that peroxide. Great. You don't dilute it. You wait 10 minutes. Most dogs or cats are going to vomit within 10 minutes. If they don't vomit, you can repeat it one more time. There. Really important. I think everybody should have peroxide on hand. I had so many people in practice, they call me on emergency. I thought their dog ate a whole bunch of chocolate, or they got into something more serious. Even something like antifreeze, right? People spill it, and all of a sudden they see their dog licking it. First thing, like before you get to the clinic, get them to vomit. Regardless, so the peroxide, and then in some cases, you can follow that up with this here. It's activated charcoal, so it just helps absorb it, right? So these are, I think, about 250 milligram capsules, 1 capsule per 10 pounds of body weight. And say, for instance, you've got them to vomit, and now you're not sure if they've absorbed some of it, move further down the intestinal tract. This will help bind it in the intestinal tract so they don't absorb it. So I always think have peroxide and have hydrogen. The hydrogen peroxide, activated charcoal on hand. It's just a good idea. If you've got an animal, especially a lab, they like to eat things and they get poisoned. I wanted to cover heat stroke. Main thing I want to talk about heat stroke is, so a dog is considered to have heat. We don't see it in cats generally because cats get out of the heat and they're not locked in the car. But when the temperature is above 105, right? So normal, that's about 40.6 degrees Celsius or higher. A normal temperature, 100 to 102 degrees Fahrenheit, or 38 is sort of normal dog temperature. So what we're seeing in heat stroke, typically these dogs are outside. Say these dogs, the brachycephalic guys, the pugs, the push-in faces, and right, for whatever they exercise in that heat, they can't cool themselves properly. But what you're going to see are they're trapped in the car. The two things you're going to see, there's just excessively panting, like they just don't stop panting, and they have this thick, ropey drool. And that thing is really classic for there's a dog that's got heat stroke. Like he needs to be to the vet ASAP. As his body temperature rises, it can affect their brain, it can affect the rest of their organs. But the biggest thing, we used to say, like, don't rapidly cool these dogs. No, immerse them in water. You want to cool them, and you want to keep running cool water on them. If you're near a lake, great, get them into that lake, right, where we live. But if you have a hose, you can run a hose on them. Yeah, you want to do that. We used to say just slowly cool them down. Like, no, you want to be able to cool them down as fast you can. Don't put a towel on them because it's going to keep their heat up. Like in no time that the towel actually will act like an insulator, keeping them hotter. What I want to mention with heat stroke, can lead to organ seizures, organ death, coma.
What about cats?
What about cats?
Yeah.
They're usually pretty smart. They don't seem to get heat stroke. Like they stay out of the heat. Now the cats he won't run in the heat. All of a sudden, like cats they figure that out. So I've never ever heard, obviously cats can get heat stroke, but in general, like they won't run in the heat. They're like, I'm not going to chase the squirrel. I'm just going to lie here in the shade. But the dogs can run back and forth and back and forth and back and forth and then have heat stroke. But yes, it's the same principles would apply. But yes, I saw many a dog that had definitely heat distress, if not heat stroke. And seldom seeing a cat.
I have one more question for the heat stroke.
Yes.
There's a hack for dogs in the summer when it's really hot that you take a towel or a tea towel, you get that wet and you put it in the freezer and let it freeze. And then
Great idea.
Would that be helpful for heat stroke or is that like too cold?
Yep, that would be helpful. And the other thing you want to do is put it in their groin because that's where there's a really big blood supply in there, and that'll cause things to cool way quicker. Yeah, that's a good idea if you have that, or even one of the gel packs that are cold. Put those into your dog's groin too, because it'll pretty quickly bring the temperature down. And obviously, if air conditioning, you're in with the air conditioning. one of the points I wanted to cover, what steps do you take if your dog or cat has a seizure? So the big thing with having a seizure is, number one, you recognize, okay, that was a seizure, maybe their legs extended, their arms are extended, they're paddling. So number one, you want to just quickly look around, okay, everything. You want to, make sure they're going to be safe, they don't hurt themselves, or if they're up on a bench, get them down on the ground, lie them on their side, right? Don't move them or grab them or anything else. Dim the lights, lower the music, and look at your watch and time it and or film it, right? Generally, we would say if a seizure lasts more than 5 minutes, you need to get into your veterinarian on emergency. If it's the first time your dog has ever had, or cat has ever had, so a different dog's ever had a seizure, you're going to time it. You definitely want to go in and see your vet. If you have an animal that isn't epileptic, and or this is their second seizure in a short period of time, right? Then obviously you want to get in, right, as soon as you can. But the point of a seizure, if it's generally 2 minutes or less, I'd be like, okay, we can monitor that and hopefully we can control that. We're still going to see your animal, but you don't need to rush in on emerge. But yeah, you need to be in for an exam, and we have to work up other things. Possibly you've got a dog that's got epilepsy, you're going to treat them accordingly. But while they're seizuring, that's it. Just make sure they don't hurt themselves. Dim the lights, lower the music, right? Make sure they're off. They're up high, make sure they're lying on the ground. And then going through the seizure and then getting them examined after the fact. How do you treat your dog or cat for a bee sting or allergic reaction? So in general, I said it's not as critical with our dogs and cats as it is with people. We have a whole bunch of things called mast cells in our lungs. And if they degranulate, they release all this histamine, and that's why we can have difficulty breathing. It can happen in our animals. So that's why it's just a good idea to have something like Benadryl on hand. You're just going to assess it, whatever's going on. And then you would, if you saw to the point where they had respiratory breathing distress, like it's difficulty breathing, then you're going to, obviously you won't need to be having them seen as soon as possible. But prior to that, if you saw hives here, for instance, and you're a little bit of ways from a veterinarian, pull out the Benadryl. Is what I would suggest to have on hand in that situation. Most of the time, a sting, it's a localized reaction as well. You're going to treat it like a surface wound. There's not a whole lot you need to do in that situation. But I just think that's why it's good to have something like Benadryl on hand. So maybe you're going to see multiple bumps throughout your dog's skin. That's called hives. Before that progresses to something more serious, then if you can, talk to emergency vet first. They say give them Benadryl, but I just think that's when you want to have the Benadryl in hand for a situation like that. A couple more things I think I want to go over, because I don't want you guys to miss, is number one, what do you do if your dog or cat is choking? All of a sudden, you've been throwing them a ball, and all of a sudden, they stop, right? And I'm just going to grab Tula, who's not going to like this. It's okay, though, Tula, right? We've thrown you this ball. That's probably too small of a ball. There. Oh, right? And you're like, it's clearly they're having difficulty breathing. They may be pawing at their throat. Their neck might be extended. They might sort of almost look like they're gasping. So you're like, okay, and they might even just drop to one side. Right? So if they're alert, like they're still like this, and it's not like this, but they don't appear to be, they're not unconscious yet. You're not going to stick your hand into your dog's mouth. They're going to be pretty panicky. You might feel a bump right here at the base of their neck. And there is a technique I've talked about. It's called the external extraction technique, where you put a dog on their back. But the principle here is you're actually pushing along here where their airway is, or their trachea, and you're pushing out. And what you're trying to do is, typically what you're doing is you're putting your index fingers up against the back of their jaw, and you're using your thumb to push this ball out of their throat. And I have seen a ball where a dog swallowed the ball. It's actually a Kong ball covered in saliva. We cannot get it out. And that would be a way where you actually could potentially use it, where you hooked your thumb behind it. But for most animals, whatever they're choking on, like you recognize they're choking, and you just threw that ball, you see that, like, is my dog breathing? You feel his chest not moving. You put your hand up against the end of his nostril. There's no air coming out. And he's gasping. You might put your hand over top of his muzzle, blow through his nose, right, little Tula? Guess what? There's no air going into his nostril. You're not seeing his chest rise. So then you know, like, it's obstructed. Like, there's something in there. If your dog's unconscious, animal's unconscious, you're just going to use your fingers, sweep in first the back of his throat, see if there's something there, you can hook it and pull it out. If you can't do that, like all of a sudden that ball's in there and you can't get it out, your dog is now not conscious, they're lying on their side, right? You couldn't sweep it and hook it out. Then you're going to do the Heimlich. So the principle of the Heimlich, Tula doesn't really want to get the Heimlich done for her, but you're going to hang her upside down. I'll just show you here, little Tula. So you're going to use gravity if you can. The big dogs you can't. And you're putting pressure on their belly or their abdomen, and you're going up and in, right? And I'll just show you you can think of it like this. You can lock your hands together. You're going up and in, right? This, because you're trying to put force on the belly, and that's kind of a force on their abdomen, which is then potentially help expel that mass. But the easiest way is using gravity. So what I've always taught is hang your dog upside down first, but I don't think that's going to work for little Tula today.
I don't think she likes that.
First aid, bad experiences. So you're going to hang your dog upside down like this, right? So your head's hanging here, their spine is up against your chest, and you're putting pressure right here. So you've got right here, and you're going to put one hand on the middle of their abdomen, and you're pushed down and in, because you're trying to put pressure here. So you're going to make five firm thrusts. You can make a fist if you need to. There, as I squish a little lamb chop, pushing it down and in. So you make 5 firm compressions or thrusts, and then you're going to like put your hand over top of their nostril, their muzzle, blow into their nose, 2 breaths, did the chest rise? Yay, you've got the obstruction out. And the reason I like hanging them upside down is you're also using gravity. For a big dog, you can't do that. Maybe you just have them on the side and you're going up and in, right? Where you're going underneath the abdomen. You're trying to go just underneath the rib cage, up. I'll just show you on Tula. I won't do it. I'll show you exactly where, though. Just show you, Tula. You're a big dog. So you're going just up in here behind her rib cage, right? So she's a big dog and she's not moving. You're going up and in, right? But you got to put a fair amount of force. You've already compressed that at 1.5 to 2 inches. Like, it's got to go in a long way. So it's much more force than you think. But if your dog's choking, like, you got to do whatever you can to get it out. And that is the principle of the Heimlich, right? Which we're not going to do on you today, and you're all finished. The fast Heimlich. I do have a little, we've written about it in it. I think it's on the blog as well too, where I demonstrate show you how to do the Heimlich.
And you did do it on Lewis. So
yeah, I did on our big fast dog Lewis, who was just sat there, was completely fine with it. I could compress him down, in and down. In people, what they're actually doing, you're actually making a bit of a turning motion. So it's like up and in, right? Blech. Apparently you can do the Heimlich on yourself. Oh, I think that would be rather difficult.
Oh, yeah. Okay.
Then once you've done the Heimlich, and assuming that you go through then you're going to go through the steps of CPR. If your dog is breathing, if your dog's heart's beating, fine. If they're not, you have to go through the CPR steps. So I'm going to use lamb chop here for our CPR dog. Right? Let's see here. CPR. So the big principle with CPR is your dog conscious or unconscious first? Like, he's sitting up, he doesn't need CPR, but he's lying there, he's not moving for whatever. Maybe it's from choking, an obstruction. Maybe it's from, who knows, he's been hit by a car. Maybe he's had some tumor that's bleeding and all of a sudden he's dropped. So first thing is you look around, stay calm, assess your dog's next. You look at his color, you see his gums are kind of bluish, like, okay, he's not breathing. But it doesn't appear he's breathing. You're going to listen, feel his nostrils. You're feeling air moving. You're going to feel under here and behind his left armpit. That's where you're going to palpate. Easiest place to feel the heart beating. Is the heart beating? No. It's difficult to take a dog pulse, but you can definitely hear his heartbeat. There's no heart beating. He's not breathing. His chest isn't moving, right? His gums are kind of bluish. Like, okay, Here's a dog that's in cardiac arrest. You need to be doing CPR. So the principle here is these dogs, you lie them on the right side, right? This. You're approaching them from this side. For most dogs, you lie them on the side unless they're a big barrel-chested dog, these pugs or the French bulldogs. Most of you're lying on the right side. Same thing with their cats. I'm actually going to get Cassie in to show you because he's pretty tolerant. Let's show them Cassie. I know we're not going to do... Oh. Right. Tula just went in there to rescue Lamb Chop. No, she's still in use, Tula. So with... Here, Cassie, and let's pretend like you're needing CPR. Okay, cat. So with our cats, you actually just use your thumb and your forefinger. And you're going in behind his left armpit here. And you're going to, and it's between the 3rd and the 6th rib space, but that's in behind the left armpit. And you compress it for a small dog or a cat, about 1/2 inch, the chest wall. For a big cat, a larger dog, 1.5, upwards of 1 to 1.5 inches. So for the cat, you're just compressing here, right? And you're going to compress at the rate of, it talks about staying alive as the song. Regardless, you're doing 30 compressions in 15 seconds. So 1, 2, 3, 4, 5, 6, 7. Okay, imagine I get up to 30. 30 compressions, 1.5 inches. It's actually, you've got to substantially compress that chest wall out to compress the heart. After the 30 compressions, 15 seconds, you then do 2 mouth to nose respirations, right? Where you close his mouth, go over top. You put your mouth over top of his mouth and his nose, and you make 2 breaths, right? You see the chest rise, great, and you keep going. 30 compressions, 2 breaths. Cassie, okay, you want to stay there, kitty cat? If you're doing most dogs, like medium to large dogs, they're on their right side, you're standing behind them. What you want to do is lock your elbows, right? And it's really hard to do CPR as far as maintain it for a period of time, because after a couple minutes, like, you're tired. So you're putting your palm of your hand. I've got my left palm. Lock my hands, right one on top, in behind that left armpit, and you're going to compress down, say a large dog, 1.5 inches, but you're keeping your elbows locked, and you're using your chest, and you're leaning forward with your body, like you're using your core to compress. So, and that would be the 30 compressions. You can see Tula, she's turning her head. You'd be surprised how much force you need to do. That's why it's really good if you can go to a pet CPR course where they have a dog mannequin, and you can practice what it feels like to compress a chest wall. Right? So you do those 30 compressions, and then you do the 2 rescue breaths. So 30 compressions, 2 rescue breaths. If you can cycle off with someone else, that'd be great. Because the most you're going to do it for is 2 minutes. That's pretty tiring. And then someone else is either called the vet, they're helping you get to the car, you're on the way to see a vet as soon as you can. Unfortunately, even in practice, it's funny, we were never actually properly taught CPR, in part because it's pretty poor outcomes for dogs and cats. They say less than 10% they need CPR are going to survive. But part of that is very few people are trained in doing it. And, they're pretty hesitant. They're worried they're going to hurt their dog and they're going to hurt a cat. But number one, knowing what to do if your dog is choking is important. Like, that's a pretty common thing. I definitely saw that a bunch of times in practice. Just the basis of the Heimlich, right? Just think, if you can get your dog upside down, putting force just under the abdomen, underneath the chest wall, in and then down. Like, so if you're going to think about it, you're just doing this down angle, right? Right there, upside down here. I think Cassie might let us. Let's just see. This cat is he's such a, maybe not. He's a tolerant cat, but he's not that tolerant. Nope. We're not going to do the Heimlich on you.
Do you have a couple YouTube videos that shows the CPR?
Yeah, we have CPR, and we have CPR did a few times on YouTube. We'll link to those, actually. It shows CPR and actually shows you how to do the Heimlich properly.
Yeah, so we'll add those underneath for the people who are hoping that the screen can be enlarged, because currently can't do that on this streaming platform.
Oh, you can't. That's a good point.
If you want the closer view, go ahead and check out his YouTube videos that will have that close up.
Okay, and then we'll show you that. A couple more things I wanted to mention. I think we're coming to the end here. I think we're actually past it. That's okay. Number one, how to know if your dog is bloating. So bloating was considered like the mother of all dog emergencies. what that means is the stomach will dilate with air, and especially these deep-chested dogs like Shepherds, Great Danes, etc. And in some cases, it can twist. But initially, it fills up. In some cases, we thought it was related to all the reasons why. Sometimes related to kibble. These dogs eat too fast. They eat and they exercise. Some people say add more water to the kibble. Some people don't. Definitely see dogs seem to bloat less if they're not on kibble. But some animals just seem to be genetically predisposed to it. So the stomach dilates with air, and then from behind, it can twist clockwise. So what the big thing with you as a pet parent is being able to recognize it. So what I would see here on emergency, someone would call me and they say he just all of a sudden he starts panting, like he's pacing, he's panting. He keeps trying to retch and throw up and throw up, retch and retch and retch, but nothing's coming up, right? So that's like a pretty classic sign of a dog's is bloating, right? And they'll get this. I'll grab you a Tula here. Here, hi, you cat. But you'll feel underneath your chest or belly, it'll be hard and distended, right? It's this big distended abdomen. And you don't have that, Tula. That's what you'll see with a dog that's bloating. But not just that it's distended, but they're really uncomfortable, right? They're often pacing, they're retching and retching, they're trying to throw up and nothing comes up. And you might look at their gums, like on her gums here, which you guys can't see, maybe, but you might look at their gums and they're going to be shocky. Typically, those gums are going to be pale, right? Because all of a sudden, when the stomach distends, it puts pressure on the blood vessels at the back in the abdomen. So they're losing blood supply. They're an animal that's in shock. So you're going to see all those signs of shock. This means you have to get your dog in as soon as you can. A couple things I've had some people do. I remember being in the Maritimes, someone was a long way away from the clinic, is number one, I said, try to see if you can walk your dog. It was going to take them a couple hours to get there. Number one was trying to walk your dog, right? Sometimes if the stomach's just distended, they can help move that air out. The second thing, there's a product here called Gas X. It's called simethicone. People use it for people that have gas pain, pressure, and bloating. Some people think that it seems to help some dogs. They've got all this amount of air. It's not going to help you if the stomach is twisted, but when the stomach's just distended with air, that may make a difference, right? And I've had a few other people suggest trying activated charcoal. Buying whatever's in there that's producing all that gas, maybe help some of that pressure get removed. So that was what you'd do. When I grew up in a farm, so we would have a dairy cow that bloated all the time. She'd get into the alfalfa, and which she'd consume vast quantities of fresh green alfalfa. Her main stomach, called her rumen, would distend, and she looked like a balloon. She'd be out to here. So our treatment at the time, we actually would stick in what looked like a giant gauge needle, and it had a plug on it, and we'd stick it into the side of her belly, pull it out, and all this air would come out. But we don't do that in dogs anymore. You need to recognize it and just get your dog in ASAP. Is the point of all that. And just knowing that's what you'd expect to see if a dog is bloating.
Okay. Have you gone through all the questions you wanted to hit?
I think we've gone through most of, yes. Feel free, throw me a few more questions there.
Yeah. Moderator. I've just been collecting some of the questions from the chat that people have written out.
Okay.
You've answered, I'd say, quite a few of them, but a couple that I just saw, though, was, do you have any tips on how to make a cat or dog swallow like a pill, the CBD drops, or like Benadryl?
To make them swallow, yes. A cat. Oh, come here, Katie. Okay. So we'll do the pretend casein pill. So for cats, you can get a thing called a pillar. But the big thing here is you've got the pill here in the end of your finger right here. You pull his lower jaw open. You just push it to the very back of his tongue. Like you got to put your finger down his throat. You close it and you blow on his nose. And most guys are going to rub the base of his throat and just keep his muzzle shut. And you'll find most cats are going to swallow then. They're going to stick their tongue out. Oh, there, you swallow the pill, Cassian. I'm going to do much the same thing with dogs, but it's got to get down to the, like you got to put your finger in there. It's got to get right to the base of their tongue. All right. No. What do you think? You're down with that, kitty cat?
Okay. Another one.
And with the CBD, you can put it on their gums. They don't need to swallow it.
And I mean, Tula loves just having any of the CBD.
Tula likes it, so it's easy. Not everyone does. And then the third thing you do, a lot of the meds now are formulated so they can be given transdermal, meaning you can give them on the inside of the ear. So for Cassian, if you're on some of these long-term meds, get them formulated and stick them in his ear tips. There, kitty cat. Okay.
Okay, here's another question, which is how do you handle an eye injury?
How do I handle an eye injury? So the first, say for instance, like Tula was running outside and she doesn't have the best vision as it is, and she ran into a stick. She's like, oh, and she's squinting like this. As an example, right? So I'm just gonna bring her up and have just a better look at her eye first. Come here. And we'll do Tula. Let's show them what we do. Like she's squinting away. I'm like, I just open her. I'm like, okay, you need to have really good light because that's the only way you're gonna have a way better way to properly examine the eye. And if I saw obviously any type of mark in the cornea, the surface of the eye, I mean, I'm getting her into the vet as soon as I can. If you have lubricating eye tears, I'll show you what. Let's see here. Here's one here actually. These are another good thing just to have normally. I have these eye tears. So these lubricating eye tears. Doesn't matter what the eye injury is. In some cases, if you think there's something in there, you can use saline as a flush. If all you have is water, that's fine. You just get yourself a syringe and here and this. Like you think something's in the eye, flush it by all means. You can do no harm with saline and flush. Even with water is completely fine. You're not going to hurt your dog or your cat by flushing with water. Then if you after, like say for instance, there had been like a corneal scratch or injury, he's squinting and it seems sore. One of the big principles is just keeping it lubricated. So getting some of these lubricating eye tears is a great idea. Because that, once again, that's not going to hurt any dog or cat's eye, regardless of whatever they've done. And then you're obviously going to get them in and see your vet and get them examined as soon as possible. But having something to flush it out and then put in lubrication is just a good idea.
Okay. Let's do a couple more questions then. Another one is Sage Salve safe to use on dog and cat wounds? It's like a natural antibiotic.
Is it? Yeah, it is safe. And it's a good idea because most of the salves that are out there also have beeswax as the base. Like that's what turns it into. That's why here's like a beeswax base, right? I'll just show you what it looks like. Like here's one here, right? So it's just this beeswaxy looking, and so beeswax itself has a bunch of really good medicinal properties. Being it's got some antibacterial stuff in it, it's safe if your dog or cat licks it, won't harm them. Yeah, it'll protect the wound and some potentially keep it from becoming infected. So yeah, safe as that would be fine to have.
Okay. And I remember another question before was you were showing how to do the Heimlich on a dog, but is it the same thing for a cat?
Well, yeah, because the principle here is all you're trying to do is if you can hang them upside down, you're using gravity. So that imagine something's in your airway, right? Ideally, I mean, for instance, I'll show you what in people what they
actually. I think you briefly did show before trying to turn.
I'll show you what they do in a person. Like say this was a baby. What they taught us in infant first aid is you pull them out of their car seat. Actually, you did this, Lassie. I think you actually choked on an avocado. Anyway, so out of the car seat, upside down with one hand, and you're actually putting pressure in the mid back, and you're pushing like that. And out came up chunks of avocado. As an example, right? So, but regardless of using gravity, and you're putting force, some type of force somehow, it seems much better if you can get on the abdomen. Right, because you generate way more pressure that's going to hit. It's hitting this thing called the diaphragm. That's the thing that separates the lung cavity and the stomach cavity. Is called the diaphragm. You put pressure in the diaphragm, puts that increases the pressure in the back of the throat. that'll cause whatever's in there to be expelled. So it's just nice. If they're upside down in some way, you're adding in the force of gravity. But yeah, same principle for a cat for sure.
Okay. Last one we could do is someone was asking, is there a way to create an airway on the fly?
An airway on the fly. You mean like,
Yeah.
the example will be like, say someone is like this dog, for instance, is all of a sudden he's choking, and you're like, how would you? We'll show you where you're not. It's not something you're going to create on the fly. I have had to do tracheotomies in practice. Like, so for instance, here, right? So say for instance, like this is say that your dog has got this ball and you can feel this lump right in here. It's right here. It's kind of lodged right in their Adam's apple. Right? So the actual area where you do a tracheotomy would be just below that. And if you put your hand back and forth, you can feel that the trachea is just that long tube, and it's made up of these rings, cartilaginous rings. And what you're doing, you actually do a horizontal incision, side to side, right? And you open it up, and you actually go in between. You're clipping the hair around here, you're putting a local anesthetic. You go in between the cartilaginous rings below the Adam's apple, and right into the trachea. And then you make this incision, obviously with a scalpel blade that you happen to have, which you wouldn't have, but that's what would do in practice. And then you're throwing in some form of tube. I mean, some people taught. We have special tubes in the clinic, right? So this would be a case where we had a dog who was choking and we couldn't get the ball out, and then I went to the point of having to do a tracheotomy. But it's not something fast and easy you're going to do. And I don't know if anyone's ever done it, like either out of the dog walk, but it's the principle. It's just you palpate it just below, and you make an vertical incision, and you're using some type of tube. Some people talk about even being able to use a pen or something. Potentially they could. It's just that's a lot to ask unless you've got some previous surgical experience.
So generally, if it's that bad, just try and get your dog to the vet as soon as possible.
Well, just if they're choking and all of a sudden they're not breathing, you can't get it out. That's their point, is that often by the time you get to the vet, it's too late. Right?
Yeah.
And that's the issue, right? It's too late by the time you get there, because by the time you get them in, like they've gone that long without breathing, and they've died. And I saw that more than a few times, right? By the time I got to the clinic, it's too late unless you're right there. So yeah, if you got some surgical skill and right, you have to have a scalpel blade and you're willing to give it a try, and you've got some rigid tube to put in like a pen, yeah, obviously that would be, some worst case scenario option that can happen. But I'm just hoping you never ever has to get to that.
Okay. Well, that's all the questions I was going to ask, because we have gone significantly over time than we were planning, but we got through all the information I think you wanted to talk about. And so for everyone else's questions who weren't necessarily answered, quite a few of them, I was just noticing that if you are very much wanting these answered as quick as you can, and even just anytime, you can go to the blog, which is veterinarysecrets.com, and a lot of those, just look up some of those keywords, and there'll be blog posts and YouTube videos of Dr. Jones's that will come up and really answer those questions. And otherwise, some of the other things that I was talking about earlier, like he was saying with all the lists for a first aid kit, those we'll list those underneath this video, so you can come back and check and write those down.
Right, and I'll just add some of those links to Liza, like some of the past ones on CPR and the Heimlich. Yeah,
we'll link those to the closer up view of how to do it will be there. And also, I did see someone mention that they had bought like one of the tourniquet things that you had. They had that on Amazon, so we'll try and find a link.
Oh, that's great. Yeah, these are awesome, because I used to use these all the time at the clinic. Or often I'd be on emerge. There's no assistant in the days. It's not like Grey's Anatomy, just you showing up at the vet clinic at midnight. So you need to take a blood sample, or you need to sedate it, whatever you need to do, right? And this is what we use. We'll put this on the dog's foreleg. Just showing on Tula.
You showed before.
I didn't do it, but I didn't do her leg.
Okay.
Yes, Tula. Good girl. That was just a muzzle. This is where you put it. So you just put it behind her elbow, and you put the tourniquet on there, right, Tula? And then I would just roll with my hand and the blood vessel pops up right there. There. That was it. Okay.
Okay, so it's very useful
I
thing.
had that a few times.
We'll link it down below then. We'll find some of those.
Great.
Things. Yeah, so
Okay, so
otherwise,
thank you guys for being on today's live stream. Hope you found it helpful. We're going to try, and then we're going to be doing another one in about a month. It's actually going to be on cancer. And we're doing it with Tucker Budson, who is a golden retriever who has they have a huge channel, I think, on YouTube, along with all the other social media sites. But
so keep an eye out for more information on that, because we'll have some more.
Exactly. That'll be towards the end of February.
Mm-hmm. Yeah. Okay. Well, I think you have to end this live stream.
Thanks so much. Oh, apparently I have to end it. Aha. Thank you guys. Sorry, yeah, thanks for sticking with my challenging technology. Okay. Thanks so much.
Bye-bye.